what needs to be done? How can PT help? Well, there's really two factors. One is, if you're not having any hip problems currently, now's the best time of all to get your hip checked out. Because every time you move in and out of a chair, up and down stairs, walk, etc., every time you're standing, you're relying on your hip joints to work perfectly. If you're not having problems, well, obviously they're working well. But you, just like your car, you get it tuned up, you get the oil changed, etc., you want to make sure that certain things aren't beginning to happen in and around your hips. Mostly that glute weakness, that hip weakness, that allows certain problems to get started. So now is a perfect time to get your hip checked out, make sure that you've got mobility where you should, flexibility where you should, and strength where you should. And the expert physical therapist at Loudoun Sports Therapy Center can do that for you. Now on the other side, if you're having hip problems or you've had hip problems in the past, there's no way to tell by going on the internet which of these problems you've had or which of these problems you're having. Now's the time, if you're having hip problems or have had it recently, now's the time for an expert physical therapist at Loudoun Sports Therapy Center to do a full evaluation of your hip, find out what's going on with the mobility, where are things flexible, how is your joint moving, does it stay open when it's supposed to stay open, is the integrity of the joint being protected, what's going on with the labrum, what's going on with the muscles, and what needs to be done for your hip versus what the internet tells you is good for everybody's hip.